We are happy as KEMRI to be co-host of this particular important conference. This conference, as you've heard, talks about integration, so it is very crucial that we integrate our services. Because if you go to other places, for example, northern Kenya, and imagine you had just one center there dealing with HIV, maybe the next center dealing with family health would probably be several kilometers away. So it is very important for us to integrate services so that when a patient goes to a particular clinic, that patient should be able to get all the available services that that patient requires. So the essence of this conference is basically to see how that integration can be rolled out in all our services.
And just as a brief background, we know that there are very many reasons for non-use of contraceptives. If you look at the demographic health surveys, they look at reasons why married women aged between the age of 15 and 49 would choose not to use contraceptives. They are basically classified into 4 reasons. One being opposition to use, either because the woman doesn't want to use the method, or there's opposition either from their partner or from other people, or even religious prohibitions. The second reason is a lack of knowledge, either a lack of knowledge because they did not know about the method, or they did not know where to get that method from. The third reason is fertility-related reasons. There are women who actually think that they are, subject and they cannot conceive. And then there's the all too obvious reason of maybe they're not having sex, or they're not having sex as frequently. And then the third reason, the fourth reason, which most people highlight, is method-related reasons. And in here we have the side effects of using family planning, the fear of the side effects, issues around access to the family planning, access being distant, as well as the cost issues. And so our main objective was to assess the impact of integrated family planning and HIV services on familiarity with more effective family planning methods and male attitudes towards women using family planning. And we did this looking at before and after the integration, and then we also compared between the integrated and the non-integrated sites.
We must do more for the teenage girl facing an unwanted pregnancy, for the married woman who has found she is infected with HIV virus, and for the mother who faces complications in childbirth. Sexual and reproductive health challenges, including HIV/AIDS, interventions and care, are really part of a human rights issue.
We have seen children even taking balloon, condom thinking it's a balloon. Mom, I had a balloon and it had yogurt inside, and I drank it. Oh my God! We have to think of how to dispose condom. Thank you so much. God bless you. Yeah! How about the king of condom? Yeah! Thank you.
There's very little research that's been published looking at the acceptability or patient satisfaction associated with integrated services. Prior to starting this cluster randomized trial in Nyanza that we presented, we did some baseline research that Dr. Cohen also presented sort of along the timeline, including interviews with men and women. And among women who were not currently using a more effective family planning method, this was again before integration, we found that close to 3/4 of those women said that they would be more likely to use a more effective family planning method if it were available directly in the HIV clinic.
Integration is proposed as a cost-effective way to provide services because we think that it will increase family planning using few additional resources in the clinic. And of course, this is very important. It's important to understand the costs in order to be able to know whether or not it's scalable in the context in Kenya and in the Netherlands. And it's important to assess the cost effectiveness in order to be able to prioritize resource allocation.
So I want to thank the study participants in Rwanda, Musike, Kisulis, and Suba districts in Nyanza. Study coordinator, Luciana Nono, Representative Richard Steinfeld, who's somewhere. Very excellent in the crowd. But Goreti Akini, Fagundi, Shiko Ngori. Family planning study nurses who are integral to the training and the monitoring and continued training of the 18 sites in the study. the FACES, Family and Education Services leadership and their staff, the data team, both at UCSF and at Emory, the Reaper for the Health and HME District and provincial coordinators, the community and clinic health assistants, which are part of the FACES program, community advisory group members, which existed in each of the 4 districts, and of course, the Bill and Melinda Gates Foundation and the